Welcome to the On Your Mind podcast, where we believe mental illness can be temporary and transformative. Stay tuned for innovative, effective tools from experts in the field of mental health. Hosted by Timothy J. Hayes, psychologist. This podcast aims to change the narrative around mental illness. Move from a place of fear to a place of hope and solutions. Here on Your Mind.
Robert C. Smith, M.D., is a University Distinguished Professor and a Professor of Medicine and Psychiatry Emeritus at Michigan State University in East Lansing, Michigan. With many publications, awards, and strong grant support, he has been involved in teaching and research in patient-centered communication and in primary care mental health since 1985. He and his colleagues defined the first evidence-based patient-centered interview, now published in a popular interviewing textbook titled Smith's Patient-Centered Interviewing, an Evidence-Based Method, published in 2018 by McGraw-Hill. It is used in medical, nursing, and other healthcare schools in the United States and abroad for teaching interviewing and the doctor-patient relationship. Dr. Smith's group also identified the first evidence-based method, the mental health care model, to guide primary care clinicians in managing mental health and substance use problems. This was published in a book titled Essentials of Psychiatry in Primary Care, Behavioral Health in the Medical Setting by McGraw-Hill in 2019, and it is widely used to teach primary care mental health. Dr. Smith's next book is for the public. The title is Has Medicine Lost Its Mind? It will be published by Prometheus Books in March of 2025. This book addresses the poor state of mental health care in the United States, why this has occurred, what needs to be done, and how to accomplish this politically. The details are available on his website, robertcsmithmd.com. Well, Robert, thank you so much for joining us. It's delightful to see you face to face.
Tim, it's an honor to be here. Thank you for having me.
I'm hoping you can tell us about your book, Has Medicine Lost Its Mind, and what prompted you to write it, and what kind of primary solution you'd like our audience to take from it, or any action steps you might suggest that they might do to help us affect change.
Yeah. Well, as many people know, there is a mental health crisis of severe proportions, especially since COVID came along. I and many others, often in primary care, but also in psychiatry, have been working for a long time to try to get medicine to improve mental health care. The problem is they have been refractory to this. And you're asking why I'm doing this is I've decided to take this problem to the public. The public needs to know that medicine is ignoring basic mental health care needs. And what I'm going to mention for your viewers and listeners is that it's apt to be scary. Basically, primary care doctors like myself, I'm one of them, primary care doctors are conducting 75% of all mental health care in the U.S. The problem is nobody thought to train us to do this. We're completely untrained. And the result of this is predictable. We don't recognize diagnoses. When we recognize them or think we do, it's usually wrong, and the treatment is usually wrong. And the ripple effect from unrecognized mental health problems, and there's some 90 million people in this country with a mental health disorder. Most of these are unrecognized by primary care doctors, and the result is devastating. Unnecessary divorces, job failure, students failing in school where they previously had done well, addictions develop,
Suicide,
incarceration, homelessness, and the list goes on and on. But don't blame your primary care doctor for this. They haven't been trained. And what this points to, talk to any one of them, they'll tell you what the problem is. Bob, one of them told me just the other day, there's no psychiatrist in my town. Another one says, well, there's a few psychiatrists, but it takes 9 or 10 months to get an appointment. And what the main point is getting at here is that psychiatry sees no more than 12% of all mental health problems in this country. Psychology probably sees another 12 to 15%. But the remainder, 75% of mental health care is conducted by untrained primary care doctors. And the solution to this is simple. Train the doctors who provide the care. And yet medicine steadfastly refuses to do this. And this is why I'm going public. The public needs to become inflamed, angry, and insist that its politicians make a change in medical education. And Tim, I could go on, but I'll let you jump in there.
Well, it's one of the big reasons that I was really excited to do this podcast, because I've worked in the field for a little over 50 years, and I know that the more I learn past getting my degree in specific trainings that resonated with me, how I learned so much stuff that was really useful in my work with people that wasn't even alluded to in schools. So I know that the absence of training is critical. I also know, I live and work about an hour and a half outside of Chicago. It's a metropolitan area. It's a big metropolitan area. And I still have difficulty finding good referrals to psychiatrists.
Yep.
Or, somebody that's in my field when I can't take everybody that's been referred to me. So imagine, and we all can imagine what it's like out in rural America, and most of America is rural.
It's a disaster.
Yeah. So one of the things that had me hesitate about this is that you're a medical doctor, and the medical doctors tend to work on that medical model and disease versus illness. And what I have found most useful over the years is the non-pathologizing approaches, and the idea that we're social beings. And so when we get isolated from our social contacts, or whatever's going on in our functioning or our handling of stress has us withdrawing from our social contacts, it exacerbates or worsens any condition that we might be having. So when I finally got to reading enough of your book and the appendices, I realized, there's all kinds of room for different solutions. And the ones that you might recommend that doctors get trained in may not be exactly like mine, but at least they're trained in recognizing patterns and recognizing, as you talk about, the mind-body connection. One of the appendices in your book talks about the history of the scientific method and the split between the mind-body units, et cetera. Can you talk a little bit about that?
And that's the single most important question in this whole debate about mental health care. That's what you're calling, Tim, the mind-body split. Just to digress one moment, you can ask yourself, how could medicine do something so stupid as not to train its graduates to care for the most common health condition they're going to see? Has medicine lost its mind? It's the title of the book. That's partly where it comes from. But if you take that to a deeper level, has medicine lost its mind? It has. Medicine lost its mind in the so-called mind-body split in the 16th century and 17th century scientific revolution. Up until that point, doctors had always seen the mind and body together. They made no distinction whatsoever. But come the scientific revolution, science was burgeoning at the time and chafing at the bit to get going, and the all-powerful Catholic Church had ruled like with an iron hand for well over a millennium at that point. But science was starting to get its feet on the ground and get some traction. And it wasn't just medicine, physics, mathematics, Newtonian physics, for example, would begin. But in medicine, to gain traction and really become a science, the basic science was dissection of the human body. Makes sense. You have to know what's in there. But the Catholic Church had prohibited that as blasphemy up until this point. And in 1537, Pope Clement allowed dissections of the human body to take place for teaching purposes of physicians. But he had one proviso. The body must first be decapitated and the head turned over to the church for proper services and burial. The head was viewed as the source of the mind, the spirit, and the soul, and that was to remain the church's province. Medicine got the rest of the body from the neck down. That is the origin of the mind-body split, but more powerful came in the next century. Descartes, Locke, Hobbes, many of these people you've heard of, they provided the philosophical basis for separating the mind and soul issues off to the church and the physical body issues to medicine. And with that, modern medicine was launched with an isolated focus on the physical body and its diseases. Now, I'm being kind of critical of medicine here, but let's realize that that approach, and that was a massive paradigm shift from previous thinking, which had held something called the four humors, which was black bile, yellow bile, blood, and phlegm. And they envisioned that those existed in varying balances. And when one got out of balance, that was a disease, and that's what caused the symptoms. Well, now medicine knew physical diseases. Big liver caused pain in the right upper quadrant. Medicine knew. So this is a massive paradigm shift, and it worked like gangbusters. Here's the best example. In 1900, life survival was 40 years. By the end of the century, it had doubled to 80 years. There is no question but what medicine has been highly, highly effective. The problem, Tim, with this mind-body split, guided medicine did great with it up until the end of the last century or so. But medicine, its very success, cured and controlled all the various
Medicine controlled.
Medicine cured and controlled all the acute scourges, diphtheria, tetanus, smallpox, and so on. And later in this century came along polio and AIDS and so on, and vast, vast improvements. This is what led to this. But as people lived longer, mental illness now surfaced as a major problem. It had always been there, but people were now living long enough and to have it become manifest to medicine. And the other thing that happened were chronic diseases replaced all these acute diseases. What we know today, diabetes, heart attacks, strokes, cancer, all of these materials. Now, the mind-body split, remember, excludes the very personhood, the psychological and social aspects of the very patient it takes care of. Well, obviously, for mental illnesses, that's excluding them. And so this is why mental illness has always been excluded by medicine. But many people don't recognize that chronic physical diseases are also being inadequately treated today by modern medicine because, and again, medicine excludes the psychological and social factors. These are the very factors that are causing these chronic diseases: eating too much, drinking too much, smoking too much, not exercising, stress, and so on and so forth. These are all lifestyle or psychological and social factors that are causing modern chronic diseases. Medicine ignores them. And for example, 30 million people, it's some 17% of all people with chronic diseases, and this is in the group that have severe heart failure or severe diabetes, they're depressed. Medicine doesn't recognize this and doesn't treat it. Here's the problem. They cost twice as much when the mental disorder is not treated, and the physical disorder does not get any better. And so that's just one downside. biggest downside. Remember, medicine's excluding the psychological and social, and yet that's what's causing chronic diseases. 80% of heart disease, stroke, diabetes can be prevented by addressing these lifestyle factors. Don't smoke, don't drink, don't eat too much, exercise. But medicine doesn't do this. And data to support that. Obesity had a prevalence of about 15% back in 1970. Today, it's nearly 50%. If
Wow.
medicine was focusing on psychological and social lifestyle factors, it could prevent all of that. But it doesn't do that. It just waits until the problem happens. Now somebody's got diabetes, they've had a heart attack. Now they treat them, but they don't cure them anymore. These people live often miserable lives that could have been prevented. So prevention requires psychosocial attention. Medicine does not do this. And let me just underscore how bad medical education is, why all of these problems are happening and could be prevented. Medicine devotes no more than 2% of total training time. This is across 4 years of medical school and 3 to 5 years of residency. On average, it's some 13 to 15,000 hours. Medicine devotes 2% of total training time. 2% is all to the most common health condition its practitioners will see when they go into practice.
The mental health
Yeah.
issues.
Yeah, and it's even worse because the only supervised training in that 2% is a 5-week rotation in psychiatry in the 3rd year of medical school. Okay, there's 4 or 5 more years after that, so whatever they learned is washed out by then. But it's even worse because inpatient psychiatry training exposes them to psychotic patients, severe schizophrenic patients, severe personality disorders, refractory addiction problems unlike what they would ever see in practice. And so, and then the rest of the training time is usually a lecture here and there. I mean, if you talk to deans and program directors, they'll say, well, we do teach about suicide and we teach about chronic pain. But when you pin them down, it's just a lecture here and there. Lectures and the cognitive knowledge that goes with that is important, but it's less important than being supervised with actual patients with the disease. Medicine does not provide supervised training with garden variety suicidal problems, depression, addiction, anxiety, PTSD, chronic pain, and a whole string of things. Our doctors have no supervised training in that at all. And so, well, let me turn it back over to you, Tim. I could go on and on here.
Well, I'll highlight that from my perspective, another problem is that 2% that they're getting is almost, as far as I know, and from the doctors I've spoken to, is almost exclusively focused on viewing the mental, emotional, psychosocial problems as a disease that get addressed by a medication.
Yeah.
And
No, and
there's a huge problem there, right? We've been through the idea that your depression is caused by a chemical imbalance, which was driven by the drug companies and the hope that there would be a solution. And of course, our quick fix desire in our culture. But now we know it's been thoroughly disproven. There's nobody who works in the field deeply who actually believes that the reason you're depressed is you don't have enough serotonin or enough Paxil in your system or Prozac in your system. And the psychosocial dynamics that leave us feeling so uncomfortable have been labeled as, oh, it's a disease. You have this disorder or this disease, rather than, oh, you lack some skills, you're in a high stress situation, or you're misinterpreting the situation to generate more stress. And we have all of these wonderful tools that could help you, but the people you go to for help don't know about those tools.
Yeah, you're underscoring, Tim, a major problem now with psychiatry. We're already saying psychiatry has too few people. Psychiatry has focused just like the rest of medicine, on physical disease explanations for problems. Psychiatry and modern psychiatry is following this to the T. They are still looking for physical diseases in the brain that cause mental disorders, or as you're saying, Tim, chemical disorders. And so the very focus of modern psychiatry, just paradoxically, is to look for disease and ignore what you're talking about is the personhood, the psychology of the patient, or their environment, their social area. And even psychiatry totally excludes that. Now, parts of medicine and psychology and social work, osteopathy, nursing, all of these people have been more aware than standard MD medicine of the psychological and social aspects of it. But it has still yet to permeate into training, even in these many of these areas.
So let's turn to the solutions you've suggested in
Yeah.
your book and some of the phenomenal research, in my opinion, you've done about what it would take to turn this aircraft carrier around.
Yeah. The first thing that needs to happen, I think I mentioned this earlier, the public, and that's what we're doing here, Tim, you and I. The public needs to be informed of the problem. And you've heard the problem. Now, what happens? So the public is upset. What happens? They demand their politicians do something. Is that effective? Well, we have evidence that it is. Ralph Nader published a book called Unsafe at Any Speed. The automobile industry prior to that was constructing automobiles so that the gear shift in them was confusing. And when people sometimes would push it to go forward, the car went backwards. They had seat belts. They'd discovered them. They knew they worked, but they were afraid people wouldn't use them and they would cost too much. So the automobile industry did nothing. Nader's book comes along, inflames the public. They get to their politicians, and the politicians then effect change. This is why seatbelts are required today. It's why we even have them. And that's why a number of other safety features in automobiles exist. The book inflamed the public. Politicians changed a resistant, recalcitrant automobile industry. Rachel Carson, this is another example of how the public must get involved. Rachel Carson wrote Silent Spring. The chemical industry at that point was as derelict as the automobile industry and, as I'm pointing out, the medical industry. They were polluting everything they touched. There was DDT in our drinking water. Rachel Carson's book came out. The public became inflamed. Politicians did something. They created the Environmental Protection Agency that we have today. This is why we don't have DDT in our water and have any other number of safety measures. Has medicine lost its mind? Seeks to do the same thing to the medical industrial complex. It needs to know what is going on and then what to do. Now, let's say the politicians agree they need to do something. What do they do? And this is one of the solutions in Has Medicine Lost Its Mind? In my opinion, the best way to change, and again, medical education is the focus. Medical education is what's got to change. This is where doctors in their, 7 to 10 years of training become brainwashed. They don't know anything but physical disease medicine. So medical education has to change. A federal commission, this is what politicians, which I'm recommending to politicians. Politicians need to establish a federal commission of some sort, congressional, presidential, National Academy of Medicine, who will investigate medicine to determine how effective it is, A, scientifically, and B, in meeting the public's needs. as you've already heard, it will be found grossly derelict in meeting the public's needs for the most common health condition they have, mental health problem. But even more embarrassing for medicine as a profession, they're going to be found derelict in their very scientific approach. Modern science, since the 1900s or so, all sciences except medicine have adopted what is viewed as the most scientific approach across the board to the various sciences, and it's called a systems view. In brief, what it means is that you look at all parts of the problem and how they interact and go together, not just one part of the problem. That's what medicine does. It just looks at one part of the problem, the part below the neck, the physical part. It ignores the very personhood of the patient they're taking care of, as well as their social and environmental aspect. And along the way, I would propose medicine is losing its own soul. And so this is what a congressional committee would find. They will find medicine derelict not only in mental health care and chronic disease care, but in their very scientific approach. That will then be the tripwire that sets off a change in medical education. And Tim, maybe you want to get into some of the specifics of that, but I'll let you jump in.
When you talk about medical science missing its mark in terms of applying its own scientific method model, the thing that comes to my mind is the book by Robert Whitaker, Mad in America, where he traces the history of, and we used to call people mad or crazy when they were not fitting into the norm, and he traces the history of that from the Civil War to today. And he highlights the fact that we have all of these medications that are promoted as these wonderful solutions to anxiety and depression and psychosis and things like that. And then he watches the chart drift upward in terms of how many people are filing for mental health disability over the years since these medications have come out. So the very simple scientific method would say something's wrong here. Let's go back and re-examine.
Exactly.
But it's not being driven. My experience, my interpretation of this is that what's being done is not being driven by the scientific method. It's being driven by the profit motive, and that has to shift or we all suffer.
Oh, for sure. There's no question. The mind-body split is the fundamental problem at root. And we've discussed that, and it has been successful, but it is now unsuccessful and unscientific. And we're not advocating that medicine scrap this, certainly. We're advocating rather that it add the psychological and social parts to it, much as modern physics came along. Relativity theory, quantum theory didn't replace Newtonian physics.
Exactly.
They complemented it.
Exactly.
And what needs to happen in medicine is that we complement our physical disease expertise with equivalent psychological and social expertise. Now, medicine has already, since 1977, a specific systems-based model for medicine, and it's called the biopsychosocial model. The problem is medicine has done nothing with this other than give it some lip service. And so that is the key issue of what needs to happen. And so we need to implement the biopsychosocial model, which integrates biological, the disease part, the psychological, and the social parts, and how they interact together. And so this is what needs to happen at this point. The medicine has this more scientific model, but refuses to use it. The public needs to tell them to use it and how to do it.
And finding it some leverage or pressure through our political system, which is the system we have available to us. And as I understand it, you've done considerable research on what that would take and how
Yeah.
effective it can be to have you take a handful of people in a medical school and train them,
Yeah.
and then have them go out and train
That's
the
right.
other people in the medical school.
Yeah.
And there's evidence. You've done the research to
Yeah.
demonstrate the effectiveness of an approach like this.
One of the problems is, what are you going to teach? Well, I and others, mainly from consultation liaison psychiatry, from psychology, from social work, there's a lot of evidence of how one must conduct primary care mental health. At Michigan State, we're fortunate to get major funding, and we were then able to systematize a method for communicating with patients and establishing a relationship, and evidence-based, so to speak, in randomized controlled trials. We then made that the centerpiece of a primary care mental health model, which tells doctors how to practice primary care mental health, and more importantly, how teachers can teach that. So the point in this is that we already know what to do once medicine would decide to do it. They simply won't. Now, the next problem that comes up with that is, let us just say medicine, this is, I think, what you were getting at, Tim. Medicine all of a sudden decides to, or the politicians encourage them to do
Force
that.
their hand.
They're
Yeah.
going to do it. Okay. You need to train all doctors that are going into practice so they graduate as competent in mental health care as in physical disease care. We're not trying to make psychiatrists out of everybody. This is just so they can handle garden variety mental health problems, addiction, depression, anxiety. And when they're not effective there, they would refer to psychology and psychiatry and various other people. Okay. We're all set. Sounds well and good. Here's the problem. There are not enough mental health people to train all of the medical students and residents that go into practice. The very shortage that afflicts the populace afflicts medical education.
Yes.
So what do? This is what I'm proposing. There are enough psychologists, psychiatrists, people like me in medical settings with some expertise. There are enough of us, say a cadre of 200 of us. We could, 4 or 5 at a time, go out to every one of the nearly 200 medical schools and train existing primary care doctors, family medicine, internal medicine, pediatrics, OB. We would train 5 to 10 of these primary care faculty for, say, 18 to 24 months, not to become psychiatrists, but to become skilled in basic mental health care. They would then, and certainly integrating with the local mental health and psychiatry and psychology faculty, they would then train their medical students and residents so that they were, again, as competent in mental health care when they graduate as in physical disease care. And that is what will get this launched. This is how to get around this problem of shortage of psychiatry faculty.
Training the
And
trainer.
this is just one step. Part and parcel of the bigger picture of this training is we need to weave psychology stands outside of medicine right now. Psychology needs to be brought into medicine. We need more psychiatrists, more psychologists. The future will be trained primary care docs like me, working in plentiful numbers across the country so we can see everybody. I would then refer to psychology and to psychiatry for problems that require that. The medical people we're training are not being trained to do psychotherapy. They're not being trained to do the specialty things that psychiatry does, such as electroshock therapy. They would simply be handling garden variety mental health problems with medications and in establishing a good, supportive relationship with the patients and addressing their psychological and social issues.
And as you say, that one of the biggest problems is that because of the lack of training, the professionals, the medical professionals who see 75% of the people who are struggling with mental health challenges have no training in identifying that the problem they're seeing in front of them has its root cause in a mental health challenge or a life skills challenge. They have no awareness of that, and so there's no treatment of any kind done for that. And instead, it's either missed completely or it's misdiagnosed and treated only with medication, etc., or hospitalization, missing the mark completely and creating more difficulties than solving.
Yeah. And it's important that all this we're talking about when primary care doctors treat. Primary care doctors completely overlook 2/3 of all mental health problems. And then it's only these ones they recognize that are a problem. And you can't refer someone to psychology or psychiatry or social work if you don't recognize the problem in the first place.
Exactly. Well, I'm looking at the clock and realizing we're getting close on time here. So I want you to just get centered and think about what we've talked about so far. And if there's some part of it that you want to go back and highlight, or there's a whole different other area of your book that we haven't even mentioned yet that you think would be important to put in this interview.
I think, Tim, my interest is in getting the public activated. On my website, robertcsmithmd.com, and don't forget the MD. There are too many Smiths out there. You'll never find me. So it's robertcsmithmd.com. On the very first page, you will see something that says Act Now. This is your opportunity to do something specific to activate our politicians. When you go to that page, you will find the emails of the president, the Surgeon General, National Academy of Medicine, your congressperson, and your senators. Simply take that email address, and then there's a sample letter down below. Plug that in to the email. Write your own story, and most of us have a story about our problems with mental health care. Put your own story in there too, and then there's this short paragraph that is requesting a federal investigation of medical education, and then simply send it. So it's my website, robertcsmithmd.com, and this is the way you can become specifically active in countermanding this modern medical isolated approach on physical disease.
Wonderful. It's exactly the kind of thing that I'm always hoping people will have an action step that helps us.
Yep. Yes,
so the
it's
book,
not enough just to complain.
Right. And the book, in case anybody wants to read it, it's a wonderful book, a lot of good stuff in it. Has medicine lost its mind? Why our mental health system is failing us and what should be done to cure it, by Robert C. Smith, MD. And if you go to robertcsmithmd.com, on the first page, you can have an action step. Wonderful. Well, it's been delightful to talk to you. Thank you so much for the work you're doing. And I look forward to specifically sending this to a variety of MDs I know who are aware that there are problems, and see if they can drum up some exposure for this message you have and your book. And thank you so much for taking the time to talk to us today.
Tim, thank you for having me, and thank you for your work in raising consciousness to this same problem.
Well, you're entirely welcome and deserving. Robert C. Smith, MD, is a university distinguished professor and a professor of medicine and psychiatry emeritus at Michigan State University in East Lansing, Michigan. With many publications, awards, and strong grant support, he has been involved in teaching and research in patient-centered communication and in primary care mental health since 1985. He and his colleagues defined the first evidence-based patient-centered interview, now published in a popular interviewing textbook titled Smith's Patient-Centered Interviewing, an Evidence-Based Method, published in 2018 by McGraw-Hill. It is used in medical, nursing, and other healthcare schools in the United States and abroad for teaching interviewing and the doctor-patient relationship. Dr. Smith's group also identified the first evidence-based method, the mental health care model, to guide primary care clinicians in managing mental health and substance use problems. This was published in a book titled Essentials of Psychiatry in Primary Care, Behavioral Health in the Medical Setting by McGraw-Hill in 2019, and it is widely used to teach primary care mental health. Dr. Smith's next book is for the public. The title is Has Medicine Lost Its Mind? It will be published by Prometheus Books in March of 2025. This book addresses the poor state of mental health care in the United States, why this has occurred, what needs to be done, and how to accomplish this politically. The details are available on his website, robertcsmithmd.com.
You've been listening to the On Your Mind podcast, offered by Journey's Dream, where we support people through mental health challenges to a place of true and lasting well-being. If you love our show, we invite you to visit onyourmindpodcast.org to join the conversation, access the show notes, and discover our helpful resources. Thank you for listening.